guys, today we are going to discuss about drugs for cough. So let's discuss. So these are pharyngeal demulcents, expectorants, and we have antitussives and adjuvant antitussives. Okay. So coming to pharyngeal demulcents, we have lozenges and syrups, glycerin, licorice. Okay. Coming to expectorants, we will call this as mucokinetics also, because they help in the movement of the mucus. Okay, they are secretion enhancers and mucolytics. Mucolytics means mucus breakdown. Okay, secretion enhancers are potassium citrate, potassium iodide, guaifenesin, tolubasam, vasaka, ammonium chloride. Mucolytics are bromhexine, ambroxol, acetylcysteine, carbocisteine, N-acetylcysteine, which is used in the paracetamol poisoning. Okay, and antitussives, these are cough center suppressants. These are antihistamines. They are chlorpheniramine, diphenhydramine, promethazine. Okay, non-opioids, these are noscapine, dextromethorphan, clofenidiol, and opioids are codeine, ethylmorphine, and folcodeine. Okay, coming to adjuvant antitussives, these are bronchodilators. These are salbutamol and terbutaline, which are beta blockers. Okay, thank you guys for listening to me patiently. Thank you.